So, welcome everyone. Welcome back to our weekly conversations on human-computer interaction and the future of work and well-being. And if possible, turn on your cameras. We love seeing you. We like to meet each other. I'd like to start by thanking the organizers. So that will be Andrew Kuhn, Linda Boyle, Rafaela Sadoun, John Lee, Manfred Seligi, and myself. And also thank you to the NSF for partially funding this event. So the first part of the event, as you remember, will be recorded. So we'll have 30 minutes or so of formal conversation, and then we will transition to a social event. So stay with us if you can. And also we very much welcome questions from the audience. So feel free to ask your questions on the chat, and Andrew will be monitoring the chat and calling on you to ask your questions. So with that, I am delighted to have Andrea Parker joining us today. She's an associate professor in the School of Interactive Computing at Georgia Tech and an adjunct associate professor in the Department of Behavioral Science and Health Education within the Rolling Schools of Public Health at Emory University. Welcome, Andrea. Thank you for joining us.
Thank you for having me.
So I'm going to jump straight in and ask about your research lab, which is called the Wellness Technology Lab. And we all have an intuitive understanding about what wellness and what well-being means, but I'd love to hear your definition as a researcher of wellness, what wellness is, and what are the different barriers for wellness and for wellness equity.
Okay, great. So yes, there are many definitions of wellness and health, and these are like overlapping concepts. But the definition that I work from is one that's holistic and comes from the World Health Organization, that really defines wellness and health as not being merely the absence of disease, but really, a person's ability to achieve their full potential. So to achieve a state of well-being physically, but also psychologically, emotionally, socially, spiritually, this sort of really holistic view of wellness, which means then that the work in our lab has sort of a broad purview of not only looking at physical health, but looking at these other dimensions of a person's life. And I also, when I think about wellness, really think about it in terms of, again, operating from this World Health Organization definition of looking at it not as like an end state to be achieved, but rather as a resource for accomplishing the aspirations that people have in their lives. So, it's really about, to what extent are people able to fulfill the roles that they inhabit to achieve the goals for their lives. And so with that in mind, with this sort of like holistic view of well-being and a real focus on to what extent people are able to achieve their potential, we see that certainly certain groups in society have been able to achieve that positive state of wellness or well-being to a lesser degree. And so health disparities reflect that, these differences in health outcomes, differences in rates of obesity and diabetes and things like that, but also differences in a number of barriers that people face to achieving a state of well-being. So we know that low income, adult populations, racial and ethnic minority groups, older adults, there are many different disparities that we see in our society, gender minorities, all sorts of things. And so I think about the barriers to wellness as really being social, fundamentally in nature. So, in public health, it's sort of a well-established thing that, these differences that we see in health are less attributed to biological differences in populations and more attributed to the social determinants of health, these conditions in which we live and work that impact a person's ability to achieve a state of well-being or not. And so those can be socioeconomic factors, where we know that education, income, wealth, occupations, these all shape access to resources and opportunities over time. Those can be racial, In nature, we know that racism and discrimination impact well-being directly, through biological responses to racism and discrimination, but also through the structuring of unequal access to opportunities and resources. And yeah, the list goes on and on. Neighborhood-based differences and outcomes and how where you live impacts, again, your access to resources, your exposure to environmental hazards, and so many other things.
And I think that we're all aware that the pandemic kind of is exaggerating and highlighting these disparities in health and in treatment, in health outcomes as well.
Absolutely.
So with these disparities in mind, what is the approach that you take to tackle these disparities through your research and with the work that you're doing with your students?
Yeah, so number one, it's highly interdisciplinary. So have collaborators from the social health and computing sciences and students from public health, as well as computer science and psychology and all different areas. So that's a key part of it. And methodologically, in our lab, we do a lot of deep qualitative work to really understand the nature of these barriers to well-being, as well as the assets that exist within the populations that we are studying and trying to design for, and then doing a lot of co-design work to collaborate with the communities we're working with to envision technologies that can promote well-being, and then building and deploying systems and studying them. But more specifically, I kind of classify the work that's happening in our lab in two broad categories. So on the one hand, we do a lot of work that examines how technology can help people cope with barriers to well-being. So for example, how can you and your family be active in a low-income neighborhood where there's less access to safe play spaces? And that work is really focused on trying to build individual capacity to cope with barriers, but also family level capacities, and then looking at building up the capacities of communities to cope with these barriers. And then the other set of work is saying, okay, how can we go even beyond that, and not only helping people deal with the unfair and unequal circumstances that exist in their world, but also address those circumstances directly. So designing and examining how technology can help people engage in activism, for example, to try to change the environments in which they live.
Great, and I know that you also have been using assets within the community, like access through church to different projects, right?
Yeah, we have, that work is in collaboration with folks at Northeastern and Boston Medical Center, and that work is looking specifically at African American churches, which have historically been a context in which many public health interventions have been done because of the historical and cultural significance of the church in Black and African American populations. But there's been less work looking at the role that technology can play in augmenting those efforts and helping to address the health disparities that exist in that community. And so, yeah, we've been doing over a couple of years a lot of community-based participatory research, trying to understand the nature of these organizations, the perspectives of church members as to how technology could be incorporated into these environments, and looking specifically at ways to sort of connect members of the church together to collaboratively pursue well-being.
Yeah, and I know that your recent work had been focusing on crisis informatics, and that seems extremely relevant in time of racial injustice, of pandemic and climate change crisis that we experience these days. Can you tell us more about what is crisis informatics and how you build tools to reach kind of very marginalized and more vulnerable populations?
Yeah, and I think that one of my students who's been leading this work, Janice, is on this, is here too. But yeah, so crisis informatics essentially this area of work that looks at the intersection of people and organizations and information and communication technologies in the context of crises or emergencies or disasters, and really looking at how these tools can support people in like preparing for crises or responding to them or recovering from them. And so we had started a couple of years ago a project that looked at what we called crisis apps, or these technologies, again, that help people in terms of crisis. Like things like, the Facebook features that allow you to mark yourself as safe. So features that are embedded within more general purpose tools, as well as dedicated apps, such as those provided by FEMA or local organizations to help people get information and support in times of crisis. And so in our work to start off with, we were really interested in, to what extent are these emerging tools actually effective and supportive for older adults who are particularly vulnerable in times of crisis. Of course, we're seeing that within the pandemic, whether it's due to underlying health conditions, limited access to income, or physical mobility issues, all sorts of things. And so we did some formative work where we did interviews, we did a diary study to understand older adults' perspectives on these tools and to what extent they felt they were useful, particularly in terms of supporting values that are particularly salient in a time of crisis. So that's supporting their sense of safety, but is also supporting their sense of dignity. And so, yeah, that work we presented at CHI last year. And, one of the things that we found was that, as you might expect, there was very little awareness of these tools within older adults, and a good amount of skepticism about them from, privacy standpoint, and being particularly concerned about being sort of taken advantage of and scammed and getting misinformation, which we know, is something that is rampant within times of crisis, and particularly older adults are vulnerable to that. But they also saw some opportunities there for, these tools to be better designed to support them in feeling a sense of safety and dignity and control, whereas they felt, existing tools didn't really support that well, particularly not a sense of dignity. They talked about things like, being able to not just get information pushed to them through applications, which is what a lot of them do, but allowing them to take action, sort of initiate, action and requests for help or contact with others as being something that's very important in terms of developing their sense of dignity.
And I think that this kind of intersection of designing technology that supports dignity and emphasize humanity is something that we're all going to tackle with in the next few years. I have many more questions, but I see that there are questions from the audience. So Andrew, can you moderate the questions?
Yes. So I guess I'll go to Chris first. He has a question about the qualitative methods and what they exactly tell us about what's going on. So Chris, please go ahead.
Hey, thanks, Andrea, for the nice introduction to this topic. Before you mentioned that you use these qualitative methods to identify these disparities and barriers, what I wonder about is sometimes as an individual, because we're individuals, we have our own biased perception of the world, right? So we might misrepresent internally what's really going on or what the barrier is or the disparity that we're running across. So I'm wondering during those interviews and observations, how do you tackle that, that you really get at the deeper causes and I think it's important to identify our own perceptions, but maybe sometimes some things that we don't even notice yet is a bigger thing, like that's more institutionalized or multi-generational. How do you tackle that? Because that's incredibly difficult to me to tackle?
Yeah, so that's a really good question. I mean, I think part of it is that we do use mixed methods, which I think is so important. And the qualitative methods are extremely valuable for doing what they were designed to do, to understand the lived experiences of individuals from their perspectives, which is incredibly important, even if it perhaps is in conflict with, you know, if you did a more sort of like quote unquote objective analysis of the issue for design, you know, because if you know, the way that people are experiencing the world, whether it's, you know, accurate or not by other people's standards, will shape, you know, what they expect from a technology, what they will feel is useful, how they will adopt it. And so I think that understanding their perspectives has been very valuable. You know, even for example, some of the work we've done around physical activity promotion in low-income families, we started out with a very sort of like, you know, they're clear disparities in diabetes and obesity, and we know that increased physical activity can help address those barriers. So how can we build tools that increase physical activity? And really, as we did a lot of field work with families, we found that they were, you know, kind of interested in increasing physical activity, but really, you know, education was a particular concern for them. And, you know, they saw that as one of the most pressing issues for their family to address. And they were really focused on, like, how do we create more opportunities to bond as a family? And that was their framing of, you know, the pressing issues that they cared about. And so then we really reoriented our design approach to be less about, like, how can we, like, encourage this physical activity behavior, to really, like, how can we support literacy development in families? How can we create opportunities for families to bond? And then the physical activity was sort of like the secondary thing. So we created an app called Story Wellness. Work was led by my PhD student, Herman Saxano. He's now graduated. Yay, Herman. Where he created this app that had families wearing physical activity trackers. The more they met their goals, the more digital storybook chapters they unlocked that were interactive and provided opportunities for reflection and storytelling amongst the families. And, you know, to us, that was like, okay, we're prioritizing what they see as, and it is still, you know, that is an important issue to address too, literacy, but it wasn't like how we were framing the problem. So, you know, that's like one answer to it. And then, you know, another part I think is absolutely, we know from, like, you know, decades of research that, like, there are these more, you know, these structural systemic issues in society that are contributing to disparities that people may not, you know, automatically speak to in interviews, for example. But I guess part of what we do is, you know, try to take our knowledge of the literature that maybe has done, like, larger scale survey studies, or, you know, analyze large data sets of, like, you know, from, like, clinical data sets and things like that, to then sort of, like, shape our interview guide to say, like, okay, the literature is telling us these things are important, but, like, let's get the more contextualized and, like, nuanced understanding of that from the populations that we're working with. So I don't know if that answers your question fully, but
it does,
okay,
yeah.
Okay.
No, because you both are, so it becomes clear to me how you integrate it with this bigger perspective. So really, the last part of your answer, right? You have this bigger perspective is out there, but you want to understand the nitty-gritty details of how that's in a specific context. So I now see that connection better.
Okay.
And I also like the first part of your answer because it really got at how you can then target that intervention in a way that's meaningful to them, right? So they actually, hopefully, if the intervention is then successful, right, they can actually notice the change. So I can see that has huge importance for them. So thanks. Yeah.
Yeah.
So I think Sanjana has a question that is really sort of the mirror image of this, maybe, but in the technology realm. But maybe you can tell us, Sanjana.
Yeah, hi, my name is Sanjana. I'm a PhD student at Penn State, actually working in the technology and well-being space. But my question is kind of, I think you touched upon a lot of the answers in your response to Chris's question, but I guess it sounds like what these populations want is to be heard and to be asked, what is it that you need? And designing technologies to support those needs is really important. But I guess my question is, how do you address needs that they might not necessarily self-identify? So for example, like social media has been a great way for people to form community around racial injustice issues and other kinds of things in this kind of time. But if you told us 10 years ago, oh, there's going to be this thing called social media where you can click a button and form, I don't think anyone expected it to evolve in the ways that it did. So I guess I'm wondering, how do you approach the balance between designing technologies based on what people tell you they need versus what you expect might turn into something useful and novel for them?
Yeah, great question. So I feel like there are two parts to that. One is, the question of how, which is again, related to Chris's question of how do you deal with, the scenario when populations are maybe not articulating needs or challenges that actually exist. And then there's the part of, how do you deal with the scenario when people are saying, I think I need this kind of technology, I would like a tool that helps me do this, and yet maybe you have ideas that go beyond that specific instantiation of, a design concept. Does that accurately kind of portray what your question is about?
Yeah, I think so.
Okay, so the first part, I think I touched on some in my response to Chris, but the second part, absolutely. I mean, I feel like that's a fundamental HCI question of, how do you, and I was just talking about this in my class of how do you move people past familiar concepts towards innovative concept, more innovative concepts, things that are more different from what they're used to. And I think that part of what we have done is, we've done so much design work with different kinds of populations, and it's always sort of less about the actual, thing that they come up with or the actual feature that they come up with, and more about understanding what the values are behind their articulation of their desire for that feature. So, people might say, I have, I would really love to have a self-tracking tool that gives me insight into X, Y, or Z. And so it might be that they want that specific thing, but really okay, why do you feel like you need that kind of insight? What will that help you do? What is your larger goal that you're trying to accomplish? And then sort of trying to help participants articulate that, and then saying okay, now we've identified these more core values and aspirations that you have for your life, and then we can see if we can explore the design space more thoroughly. Yeah, I think in the, again, going back to the physical activity example, it's just been so overwhelmingly clear to us through multiple projects that people, this is sort of a fundamental thing, but I think it gets lost in the health space a lot, that for most people, or many people, I think, being more active or eating better or, not feeling as stressed, that that is not the end goal. It's to do that so that, you can, live longer to be around with your kids, so that you have more energy, so that you have a better quality of life, so that you're able to, do whatever it is that you want to do and accomplish. And so anyways, that's sort of looking to those aspirations and goals, and then design ideating within that, I think is invaluable.
So kind of long-term goal setting versus short-term,
Yeah, I mean, I think they're both important, but not having the longer term perspective as well can be limiting in the ideation process. So, so certainly, you know, the tools that we've built, it's not that people, you know, our participants said, build this specific thing, and then we built it. They came up with lots of ideas, and, you know, and then we pushed on that, and we tried to understand where are those ideas coming from.
So I see 3 more questions that are really, sorry, Jana, you were.
Oh, I just want to say thank you.
So I see 3 more questions that are really, that I would love to get through. And what I would suggest is that we go with Diana and Albrecht first, because I think they tie in with this line of reasoning that we were just discussing, and then we'll wrap up with Chomsky's question. So maybe Diana, you can go ahead.
Sure. So semi-related to the last few questions, when I think about how to make technology, or when, like, we all think about how to make technology more accessible and more diverse, the first thought is, oh, we need to bring in more people of color. We need to bring in, like, disabled people, LGBTQ people, like just a diverse population. But a lot of times, because of systemic barriers to entry, especially in academia, we don't have access to a diverse group. So where do we go from there then? I guess. I know it's kind of open-ended.
Yeah. And so when you say we don't have access to a diverse group, what group are you meaning? Can you say a little bit more about that? Do you mean,
well,
at the faculty, like faculty, for example, in an academic setting are not diverse, or yeah, tell me more.
Yeah, I mean specifically when we're designing technologies, potentially, like, I think about how eye tracking devices don't pick up on the fact that people wear eyeliner or have glasses, and I think, oh, well, if there had been someone who wore makeup in that team, then they would have thought of that. So that kind of perspective doesn't necessarily have to be anything in particular, but.
So, like, how do we build more diverse teams of designers, researchers, developers that will actually be able to, who might be more likely to think about those sorts of things? Yeah. Oh man. Yeah. That's the that's the big question. I don't have the answers to that. I can talk about some things that I've been a part of that have tried to address that. I think, absolutely, we have seen, that that it's so important to diversify the pipeline, right? So trying to get more individuals of color to both be interested, or diverse individuals, color and all sorts, all forms of diversity, to be interested into going into a career in computing or in design. And how do you do that? Okay, first, of course, exposure at an early age to, this is like a career option. We've focused on like being able to give, high school students or undergrads or younger middle school students like opportunities to see how technology can be used to address issues of social justice, and like that's often something that's really compelling to diverse individuals. I think that and then once they get into a program that is training them to go into a career like this, trying to create a program that feels welcoming, and where they do see that's where my mind went with the faculty, question, like where they see other people, where they are able to see themselves in the people who are leading the classes. And in my class, I have really tried to prioritize bringing this semester, for example, bringing in speakers who are diverse, who are coming from diverse backgrounds, so that they then, for folks who don't want to stay in academia, but who want to go into industry, they see again themselves in the people who are coming to speak to them and share their experiences. So I feel like that's a really generic answer to that. And of course, the conversations that are happening now about like how to be, in the context of race, how to be anti-racist in organizations and create environments that feel psychologically safe, and that are actively trying to create environments that are welcoming to people of different backgrounds, and that the work sort of puts, you know, at the forefront of its focus, you know, this question of like, how can we, not deliberately or unconsciously introduce racism into our system. So I think it's a super important question, and I hope we find good answers for it. But I know lots of people are working on this issue.
It seems like a chicken and an egg problem. Like, you want to stop the funnel from happening, kind of, and have the more diverse populations at the top. But how do you get that without the mentorship at the top? And
right.
Thank you.
Yeah, no, it's definitely tough. And like, yeah, in my lab, I try really hard to have, you know, lots of all kinds of folks from all kinds of backgrounds, academically and, you know, demographically and just life experience wise. So, but yeah, it's a challenge.
So, Albrecht, do you have a question that is related to this?
I think that relates in a way, but takes it onto a different context. I think what we see at the moment, there is a lot of focus on certain areas in the world, but technologies go global. So what I realized when I was traveling in India, when I was in China, when I'm in the US, I'm from Europe. And so I think the world is very, very different. I think these differences between different places, also the value systems, also even the notion of diversity. If you go to India, if you go to Northern Africa, it is completely different from what basically the European or the North American view on things are. But if you look at technologies, we have to use technologies to basically create a value system in other places. And I think Europe has complained for a number of years that basically we get US technology and the values that come with it. I've learned that sort of from people in sort of Egypt, in Northern Africa. I've learned it from others. So basically we use technology, and the technology in the way we design it to communicate, to push values on people. And I think we have seen now the other way around. I think TikTok quite controversial and interesting things on many levels and very complex. So at the moment we see it in Europe, China is pushing with 5G, again, sort of a certain way of surveillance technologies, etc. So my question is, where are we there? So I think at the moment, the iPhone is designed as a global product. Tesla is designed as a global product. Going around the world, is it the end of global products? And does this sort of global collaborations we have with conferences, does this make sense? I think so. Personally, I'm very, very strong for getting people to see other countries. I think with Andrew and already we had things getting people back and forth, because I think this complexity of the world is going beyond a single country. And I think at the moment we see a lot of issues that are focusing on the US, and obviously sort of the topic in the US is extremely tricky, and I'm sort of feeling for many who are there sort of, and I'm quite happy not to be in the middle in some of it. To be fair, but I think that the question for me is, how do we get to sort of a global perspective, not to basically getting sort of fenced in into our own little world, even if the little world is the whole of the EU or the whole of the US. What do we do there?
Oh, that's such a good question. I think that's a really important topic. I have a couple of thoughts. So one, you know, I know that there's been sort of a growing critique and appreciation for the need to really bridge, for example, in HCI, research in like HCI4D, and then HCI that's focused on low resource communities in the US. Like that there's sort of, on the one hand, amazing work happening outside of the US focused on low resource contexts, and then work happening here. But oftentimes this work is not citing one another. There hasn't been as much of a conversation between these communities as there could be, and that would definitely be, I think, productive in trying to understand, like, what similarities do we see in experiences and challenges? What's very different? Of course, there are all sorts of differences in politics and culture and economic structures and everything. And yet, I think with those differences comes a great opportunity to defamiliarize ourselves and really push our thinking about, and question what you're doing, in your corner of the world. And there's a lot of opportunity for learning from what others have done, and pushing our creativity. And so I think, that's like one concrete example for how to, in HCI, try to nurture a more global appreciation for issues, creating more opportunities for those conversations to happen. Another, thought is, I've recently been in conversations with some researchers in the UK about creating, a distributed sort of lab partnership between that university and Georgia Tech to try to facilitate conversations about how to address community-based issues and do community-based work. And part of what we've been talking about is, like, wouldn't it be really interesting to have to be able to number one, share our learnings based, like what's happening there and what's happening here, but also to be able to put communities, like the actual communities we're studying, in conversation with one another. Like, so as we do this design work with our individual communities, facilitating this sort of cross-country, design activities and sharings of ideas to broaden our perspectives as well as our participants' perspectives on what is possible. So I think these are like a couple of examples of how to support that broader global understanding, while also appreciating that, of course, the whole point of doing like community-based work is appreciation that no community is the same, and each has its own values and challenges and perspectives and needs, and that sometimes, a more bespoke or tailored approach to design is what's really needed, but that also we can learn from other contexts as well.
Right, thank you. And I'm going to thank Andrea for this fascinating conversation. I know that we can continue this conversation for a while, so perhaps you will stay after I'm going to stop the recording. I just want to mention that join us next week. We will have Susanna Boll from Oldenburg joining us to talk about teaching, making together alone, how to teach hardware-related courses at this time when we teach online or hybrid. So thank you, everyone, and stay with us for the informal part.